Hi, welcome back to my channel. In this video, I will be talking about cellular adaptations so that it is easy for us to remember them through examples. So, starting from the first one, which is atrophy. So, atrophy. So, atrophy can be regarded as decrease in size or decrease in cells. Now, every cellular adaptation has a physiological type and a pathological type. So, first we'll talk about the physiological and then we'll talk about the pathological. So, in physiological, if you see that we know about an organ which undergoes negative growth, which is also a question in ortho, that is thymus. Then, second is appendix. Then, as age increases, brain also undergoes atrophy, and then gonads undergo atrophy after menopause. Now let's talk about pathological. Pathological atrophy is the most common example is disuse atrophy. Then we can see atrophy in after ischemia in brain. Then due to pressure in renal parenchyma and during decreased nutrition, that is in starvation. Now let's talk about the second cellular adaptation, which is hypertrophy. Now hypertrophy is nothing but increase in size. Now again we will talk about it in two forms. One is physiological and one is pathological. Physiological hypertrophy is pregnancy. Here there is a catch. You should know that hypertrophy in pregnancy is like taken in consideration in the second and third trimester, but I'll tell you later on. And in pathological we have, see, you have learned about left ventricular hypertrophy. Then there's a question that in nephrectomy what is seen. So in that hypertrophy is seen, like is more preferred than plasia. Okay, now let's talk about another one, which is hyperplasia. So hyperplasia is increase in number of cells. Now this is also two forms, physiological and pathological. Now here the catch, I told you before, in second and third trimester of pregnancy we consider it as a hypertrophy, but the first trimester of pregnancy we consider it as hyperplasia. Then coming on to second is growth of breast during puberty. Then compensatory hypertrophy, like if you lose a kidney, so there will be compensatory hyperplasia of another kidney which is left. Then same can be seen in liver, then skin also. Then coming on to pathological, most asked question, or like most you should know, is keloid, then endometrium. Third is warts. Warts are seen in human papillomavirus infection. Then the most confused one is the metaplasia. So let's talk about metaplasia. So in metaplasia, there are a few things. See, first of all, you have to know that after metaplasia, like there is change in the type of epithelium. Okay. Now this can be due to any stimuli or due to environment and so on. So in metaplasia, like the name that comes before metaplasia is the final epithelium type. So osseous metaplasia. Now osseous metaplasia example is myositis ossificans. Now sometimes they ask a question that which is myositis ossificans is seen in, like, in which muscle of facial muscle, seen in mostly in masseter. Okay, then second, osseous metaplasia. Then there can be cartilaginous metaplasia. Now cartilaginous metaplasia can be seen in a fracture. Okay, then third is squamous metaplasia. Now squamous metaplasia, you need to know all the examples, it's very important. It is a smoking example, and in vitamin A deficiency. See, vitamin A deficiency leads to the core function of vitamin A is epithelialization also, right? So it leads to squamous metaplasia. Okay, then coming on to the fourth one, which is columnar metaplasia. Now see, the final epithelium type is columnar. So columnar metaplasia, you need to by heart this example, which is Barrett's esophagus. All right, and in chronic bronchitis, and also in bronchiectasis. Okay, so this completes the cellular adaptations, and I hope it was useful. And you just need to know the examples well for the MCQs, and basic is clear. So yeah, so thanks for see, here in physiological we can also write exercise. Okay, the muscle pump, right? Yeah. So these are the examples of cellular adaptations. If you like the video, do subscribe to my channel, and I'll be covering general pathology more. So yeah, so thanks for watching.